First, I think we have to state that the St. Gallen meeting, the consensus conference, is not a guideline conference, and it is not producing recommendations. It is a very interesting meeting of international experts from around the world discussing their different views and voting on clinical situations. I think it is very important to put that in first, because there have been some discussions about things where there have been actually no really new data, but they still discussed things. And on the other hand, we had some discussions about things where we had very, very actual data, and where the St. Gallen consensus was really going, is actually at the head of the movement. And so, what I personally found the most striking thing is that the panel actually agreed that the results of the ADAPT trial, so the dynamic measuring of Ki-67 before deciding about primary surgery or chemotherapy, they decided that this is acceptable, which is what I, from my personal opinion, in combination with a recurrence score, with a multi-gene assay, which, from my opinion, is definitely a very modern approach for risk assessment in hormone receptor positive, HER2 negative breast cancer. On the other hand, what I saw in that meeting is that we in Germany are a country of neoadjuvant therapy. We are almost every chemotherapy we are doing in the neoadjuvant setting, in triple negative breast cancer, in HER2 positive breast cancer, and also in high risk hormone receptor positive HER2 negative breast cancer. And St. Gallen reflected the fact that this actually is a German specialty, because St. Gallen put a lot of stress on the fact that neoadjuvant therapy is actually more or less reserved for high-risk disease, and that I think the place they see for adjuvant chemotherapy is a lot higher than we do personally in Germany.